Hi everyone, it's me, Saibi Kabilin, a student nurse from the University of Mindanao. So for today's video, I am going to perform how to assist a client with ongoing nasogastric tube feeding. But before that, let me define to you what is nasogastric tube feeding. Nasogastric tube feeding is a device that is inserted into your stomach through your abdomen. It's used to supply nutrients when you have trouble eating. And its purpose is to provide long-term nutritional support and to regulate the flow of liquid nourishment by bolus, by continuous and intermittent feeding, or by the feeding pump method. As you can see in the video, here are the materials needed. A tray containing with the following materials. Here are the step-by-step process of the procedure. The first procedure is to check the physician's order for feeding. This to ensure that correct feeding will be administered. The second procedure is wash your hands, then assemble equipments. Hand washing minimizes the spread of microorganisms. The third procedure is to identify and explain the procedure to the client. Proper identifications of client prevents medication error, and proper explanation allays anxiety and ensure cooperation. Good morning. Ako di ay si Saibi Kabilin, ang imong student nurse karong adlaw. So karon ma magpakaon ko sa imuha pinaagi sa imuha NGT tube. Okay. Excuse me ma'am, pwede na ako ma-check ang imuhang ID band po?
Yes po.
So ikaw si Miss Hadi po?
Yes po.
The fourth procedure is to assist for food allergies, time of last feeding, bowel sounds, and laboratory values. Proper assessment prevents risk of complication. So, ma'am, naman kay allergy sa pagkaon?
Wala po.
When ka last nagkaon, ma'am?
Kagabi.
Pwede na ko i-check ang imuhang bowel sounds po.
Yes po.
I-expose na ko gamay ang imong tiyan, ma'am. Pwede
Opo.
na. Thank you, ma'am. The next procedure is to assess signs and symptoms that would suggest lack of tolerance in the previous feeding. For example, abdominal distension, etc. To enhance gravitational flow of feed through tube and prevents risk of aspirations. Excuse me ma'am, wala man ka naglisod og hinga no?
Wala po.
Wala kay constipation po.
Wala.
So i-check na ko balik ang imuhang bowel sounds ma'am ha. Expose lang na ako. Tapos ang imuhang tiyan. The next procedure is to raise the bed to a working height to ensure proper body mechanics. Ako'y pataas ang imong bed po, ma'am ha.
Okay po.
The next procedure is to assist the patient to sit up with his or her head elevated at least 45 degrees. Pillows may be used to support the patient. This position enhances the gravitation flow of the solution and prevent the possibility of aspiration into the lungs. Excuse me po, ma'am. Pwede ipataas na ko ang imuhang bed, ma'am?
Yes.
Excuse me po, ma'am. Magbutang ko ulan sa imuhang
Oh, sige.
Excuse me po, ma'am, ha? The next procedure is wash hands. Hand washing minimizes the spread of microorganisms. Next procedure is to expose the nasogastric tube. Place the basin under the tube and uncap the tube or remove the plug to start feeding. The next procedure is to spread paper towel on the chest area to avoid spillage of the feeding formula. May mama, magbutang kog tissue, ma'am, ha?
Sige, sige. Lilo.
The next procedure is to aspirate for stomach contents to verify placement. Reinstill aspirate. If it is greater than 100 ml, delay the feeding for 30 minutes to 1 hour and check again. Ausculpate the abdomen for presence of bowel sounds. Notify the physician of high gastric residuals, absence of bowel sounds, or patient's complaints of abdominal discomfort before administering tube feedings. This to reduce risk of gravity regurgitations. The next procedure is to pour warm water into a cup. Draw up 50 ml of warm water into the syringe. The next procedure is to gently irrigate the tube with the water. If the patient coughs or appear to be choking, do not administer feeding and notify the physician. Flush the nasogastric tube with 50 ml of water every 8 hours to prevent clogging. This to maintain patency of tube. The next procedure is to clamp the nasogastric tube. This to prevent air from entering tube. The next procedure is to remove the bulb or plunger from the syringe. Reattach the syringe to the nasogastric tube. This to provides system to deliver feeding. The next procedure is to pour the prescribed amount of feeding into the syringe. Open the clamp and allow it to empty in, adding more feeding as the syringe empties. Follow the feeding with 50 ml of warm water. This to provides nutrients as prescribed. The next procedure is to clamp the tube before it empties and remove the syringe. This to prevents air from entering tube. The next procedure is to clean and discard the equipment. This to prevent infection. The next procedure is to document the type and amount of feeding, amount of water given and tolerance of feeding. This for information to the health practitioner and legal purpose. The next procedure is to monitor for breath sounds, bowel sounds, abdominal distension, diarrhea, constipation, and intake and output. This for possible complication to occur. Excuse me, ma'am. Wala man ka naglisod og hinga, no?
Wala pa.
Wala kay constipation po.
Wala.
So, i-check na ko balik ang imuhang bowel sounds man, ha? Expose lang na ako. Tapos ang imuhang channel.
Ako, di ko mo pilok ko kasi ako patay-patay ko.
CPR.
Konti yan ang kabayo na ako.
Ay, ganyan ako.
Oh, di.
The last procedure is to instruct client to notify the nurse if he or she experience sensation of fullness, nausea, or vomiting. This to assess further client's condition. Excuse me, ma'am, kung ka-feel ka nga kalibangon ka or kasukaon ka na, ina lang mi, ma'am, ha? And that's how I perform nasogastric tube feeding. Thank you for watching. I hope you learned something.
君の虜になってしまう